month of treatment. But here we are. So there was a sequence of wire. That's why the wire are no longer round wire now. They are rectangular thermal ultra wires. And you can see there is a space between the lateral incisors and the canine. There could be many reasons for that. I can see that some of you are raising your hands to ask questions, and from what I understood, questions will be at the end. So please write them somewhere, and I will answer all of your questions. I promise. So the patient has worn elastics 22 hours a day for 6 to 9 months. And here is in class 1, which doesn't mean he stops the elastics. I will ask the patient to keep on wearing elastics at night to stabilize the class 2 correction. You can see from the lower left side corner of the screen that there at the beginning there were some bite blocks, but as soon as the overjet is small, it's possible to bond some anterior bite blocks, which are of course best to correct the deep bite than posterior bite blocks, because posterior bite blocks actually it's the opposite. They will tend to intrude a little bit of molars, but anyway, because of the leveling of the arches with the wires, there is less deep bite than at the beginning. Okay, did I say it all about everything? Yes, I said it. Okay, let's keep on with this case. So this was the beginning, and here is patient at the end. As I told you, see there was this difference, but that was already at the beginning that we couldn't see because of the deep bite. And the patient is a nice class 1 with his permanent retainers top and bottom at the end of treatment. And it's been a year and a half treatment. So if I want to sum up with short elastics, I will use them since day 1, or when the 2 arches are bonded. Actually, what I do in my office, I will bond first the upper arch, I will bond second a month after the lower arch, and then I will start the elastics when I bond the lower arch on the second appointment. So as I said, this is a nice idea. If you want to open the bite, if there's a deep bite, then you would use the elastics rather, of course, class 2 from upper 4s to lower 6 to open the bite. And if it's the opposite, if you have an open, not an open bite tendency or upper incisor protrusion or hypodivergence, then you would rather use your elastics from upper 3s to lower 5s, which makes sense. And I would use basketball elastics for the first 6 months. When I get to 18 by 25 thermal ultra, then I will use baseball elastics. You can find those, of course, with all your commercial people that will sell the brackets and elastics. And they are a little bit, they are 3 ounces, and I will hook them from upper 3s to lower 6 to finish with the class 2 correction. Okay, so of course between the 014 and the 18 by 25, there is one intermediate wire which could be 18 by 18 or a 14 by 25. So if I want to speak about the advantages of shorties, actually there are many. I would like to speak about it. First of all, let's talk about the compliance. Okay, compliance is always a big issue in orthodontics, especially in our country. I live in Paris. Young people are teenagers are very difficult. They are not docile. They are kind of rebels. So they are Latin also. So compliance is a big issue, and that's important for me to have good compliance. So compliance, it's been proved, is always best at the beginning of treatment. As they say, compliance is the younger the patient, the better. So when you use elastics at the beginning of treatment, instead of at the end heavy elastics, the patient is younger, of course, on a 2-year treatment, for example. So you have better chance for compliance. And also, in case you need heavy elastics at the end, the patient will be ready for that because he would have worn the short and light elastics from the beginning. So it's used to those elastics, it belongs to the treatment, to this day-to-day life. So huge advantage for compliance. Also, this is not compliance here, this is growth, I'm sorry. The shorties, since you use them from the beginning, you have more chance to hit the growth spurt, okay? If we talk about permanent dentition patients, sometimes they have the last teeth to erupt, they erupt at the age 13 or 14 years old. So they are already old. So you have to use elastics from the beginning if you want to have a chance to hit the growth spurt. And you'll have it because of long-term elastic wear. Start elastics when the teen is young, okay? Another other advantages is stabilization. So let's imagine that you used a functional appliance and you bond the brace, you went from a class 2 to a class 1 and you bond the braces, the brackets. If you don't use elastics from the beginning, then there are some chances that your patient would relapse. So the short elastics, as I've shown, are a way of stabilizing the class 1 that you get from a previous functional phase. Another thing, let's say you are in a class 1 relationships, and you have a slight class 2, then you bond some bite tubules. The bite tubules will open the bite, and you lose the class 1, and your patient will come back in a slight class 2. Then the short elastics will help the patient to keep his class 1 after you use the bite tubules. I hope I make myself clear. It's a treatment. You use some shorties. Using of shorties is a way to simplify your treatment because you get rid of the most challenging problem. If you are genius users, you may know that aligning the teeth, getting the right torque is very, very easy with the genius bracket and wires, with the genius technique. The class 2 corrections is another challenge. And you will get rid of it if you start correcting it from the beginning. Getting rid of it means that you will more chance to avoid extraction surgery or the use of forceps. And then if you get rid of the most challenging problem, which is the class 2, at the end of treatment, you will be able to spend the good energy on finishing procedures to have the most beautiful case instead of wasting energy trying to correct the class 2. Short elastics belong to a concept of sagittal first experience in orthodontics. Correct sagittal anterior posterior relationships from the beginning. To make a summary, the advantages are compliance, growth, and stabilization. Well, if you don't like shorties, why such a sentence? Because I met some practitioners that have this fear of using elastics on very thin wires, the start wires, the P014. I never had any problem, and I've treated hundreds of patients with this technique. But sometimes it's difficult to overcome fear, right? Well, what are your choices? What are your choices if you don't want to use shorties? Well, you can wait for the last stages of treatment with rectangular wires and use heavy elastics. There are some disadvantages, as I said, because your patient is older, is less compliant. This is the last stages of treatment, and suddenly you would use big elastics, and that could hurt. Also, there could be a pain problem. From Spain, we have learned these techniques, which is called bevel bite blocks, which are a bite block built with glass ionomer that you can see here in blue. So you have one upper bite block, one lower bite block, and they are used the way in order to get forward position of the mandible. The mandible will slide forward because of those upper and lower bite blocks, and help the patient to position his mandible forward to get a class 2 correction from the beginning without having to wait for the last phase of treatment if you don't use short elastics from the beginning. Okay, I cannot go into detail into the way to build those bite blocks, but they works fine. And actually, to be honest, I use both. I use the bevel bite blocks, and I also use the short elastics. I use both, and it was really nice. Okay, so those bite blocks are the same concept as the mandibular, the advancement wings from Invisalign, or the bite block appliance from McNamara. If you don't like shorties, then you can use heavy elastics from the beginning. It's possible. So we are in a sagittal first concept with the carrier motion, or the genius sagittal first, which comes from the carrier motion concept. And the genius sagittal first has some advantages over the carrier motion, as I will show you. Let's talk about first carrier motion. Carrier motion is great. It's been invented in Spain, in Barcelona, by Dr. Carrier, the father. Now the son took over. They are very clever people. And thanks to them, we have this concept. I don't know if you know about it. I think it's very popular in Europe. I think it becomes popular now in the States. Not as much as in Europe, but it's very nice. I also use it, by the way. I use this kind of concept, by the way, to correct my class 2s before Invisalign patient, before treating a patient with Invisalign. And this is the way it works. So you can see on the right image the carrier motion on the maxillary arch bonded from upper canines to molar. There's a ball joint on the molar tube, and there is the lower anchorage here. I will show you everything in detail in a minute. So the carrier motion works this way. So what I'm showing you here, both pictures are the same patient. Okay, I know it doesn't look the same because there's only been like 3 bonding attachment, like the carrier on the top and this one. And you can see there's a class 2, there's a class 1, and also you can see that the bite is corrected, and you can also see that the crowding has been resolved with just the correction of the class 1. So this is the same patient, right? So sagittal first is class 2 correction. It corrects 1 millimeter per month, and it's used at the start of treatment. And how does it work? The concept is the following. You got heavy interarch elastics from the beginning, anchorage at the mandibular arch, I will show you. And the effects you get is distalization of upper canines, bicuspid, and molars. You got a rotation of the upper first molar, which helps you getting the class 1, which is very important. And of course, you also have, for teen patients, a mandibular forward repositioning, which could be growth. In some patients, it's growth. In some other patients, it's what we call repositioning between the condyle and the glenoid cavity. This is a simplified variation of the carrier appliance that has been given me for a very dear friend of mine. It's not coming from my office. So this would replace the carrier that you can see on the lower right image. That can be bonded directly on the teeth, and it's but there are two problems with this kind of appliance. First of all, you have to take an impression and spend time to fabricate it, or ask someone to fabricate it for you. And there's no ball joint in the molar, so there's no rotation of the molar. And we all know that rotation of the molar will help you in getting a nice settled class 1. So I've shown you the carrier motion. Now let's go from carrier to genius. So what we did, I'm sorry, but the Spanish and the French will recognize on the left side the Spanish omelette and on the right side the French omelette. Is about, so it would be the same result, but it has a little different taste. So let's see some cases now to see how we correct the class 2 in a few months to start with the carrier not with the carrier, by the way, sorry, with the genius sagittal first. So this is again a class 2 division 2 with some retrusion of the upper incisors and deep bite, but of course you can see that the patient is in a class 2 relationship. Here, besides the class 2 relationship, we have a canine that is acted, and basically to find enough space for the canine, we have to get a class 1 relationship on the left side, but also, of course, on the right side. So let's look at the left side, please. So you can see we have a class 2 relationship, which is about 3.5 millimeters, 4 millimeters, depends how you measure. And let's look at the effect of the. Yes, I'm sorry. This is what we want to. I'm going to come back. Okay, so the diameter of the baby canine is not enough for us to have the real canine, the permanent canine, into the arch. So of course we have to get a class 1 relationship, and for that reason we need to move back the premolars and the molars. So this is a way to do. Let me check this. Sorry. Right. So this is the genius sagittal first modified from the carrier. As you can see, we had some. We asked the patient to wear class 2 elastics. You cannot see the button that is on the lower second molar here on the picture, but there's only one genius bracket on the first premolar, one tube on the first molar, and the patient has 1 elastics. And the result is a class 2 correction and the deep bite correction without any other things than the genius sagittal first for 4 months. In my opinion, the correction of the deep bite is it comes from the clockwise mandibular rotation because of the class 2 elastics. And from what you can see also from the purple and the green line is that you always have to try to get some hypercorrection of your class 2. So what's nice is that in-office fabrication, which is just 2 brackets and a wire, allows to vary the length of the genius sagittal first without an important stock of carrier motion in your office. You just will do it in office. That's very, very, very easy. Another case. Here, you can see the class 2 relationship on the right side only. The class 1 is left. So we need to drive back this segment, upper right segment, distally about 4 millimeters again. Because the class 2 is asymmetrical, the midlines are off, okay? And also because there is a deep bite because of the class 2 relationship. And look, there's a difference of level between